Thank you, and thank you everyone, both at the Journal as well as all of our distinguished speakers, and for all of the registrants out there. Although it's not World Rabies Day yet, we recognize that it's not about a day or the day, it's about the disease. And the reason why 28 September was picked was because it's the commemoration of the death of Louis Pasteur. And so just as a phoenix rising from the ashes, we hope that as the godfather of rabies vaccination, that World Rabies Day would be an opportunity not owned by any particular day, but rather shared by the world in regards to attracting action and activities and advocacy over this particular disease that is still, unfortunately, as an ancient problem on all inhabited continents. That's also one of the reasons why we have this global webinar starting in Australia and moving from east to west and ending in the New World in Peru. We hope that this distinguished group of individuals will be able to share their knowledge, skills, and abilities with you today, and also that you have an opportunity to ask some of your burning questions, and that we'll have a spirited and provocative discussion, both midway technical. We hope that you're able to enjoy and appreciate this presentations today. And without further ado, we will start with our first speaker, who is actually, in essence, a tripartite. Dr. Philip Mshelbwala will be joining us, who is a Nigerian, who is going to be speaking about a grassroots approach based upon his assignment from the OIE in Sierra Leone, but also will be joining us from Australia at the University of Queensland. So given that multi-partite background, we're very interested to hear, as he's going from a country that's often spoken about as being rabies-free, Australia, but of course we know it's not. It's just unique in that it's the only continent that has rabies, but no rabies virus. Philip, without further ado, I invite you to share your participation with us today, please.
Thank you very much, Professor Charles Rupert. Thank you very much, Professor Charles Rupert, for the introduction. And I want to sincerely appreciate the One Health Implementation Research for inviting me to share my experience while working with the good people and control towards the 2030 Elimination Action Plan for Sierra Leone. And this is the background of my discussion. I will start really by being the first speaker of the session. I feel because of the diversity of our audience, I will take the pains to really provide some background information about rabies, to highlight the global control, global targets towards 2030 control of rabies, to highlight key rabies situation across Sierra Leone, and to justify why we need to develop the national so the Sierra Leone is a country in this southwest coast of Africa. The map here shows the 16 districts across Sierra Leone. It has 16 ethnic groups with several languages. The country, Sierra Leone is in the southwest of West Africa. As I said, it's bordered by Liberia to the southeast. And this figure here shows the annual growth rate trends between 1955 to 2020. There was steady growth across the years with significant drop, especially during the year during 1990 when there was a civil war across the country. However, over time there was an increase in the trend across the years. As just to really, at this stage, I would like to provide a background information because of the diversity of our audience. Rabies is an acute progressive viral encephalitis caused by the rabies virus, as we all know. Sorry for our experts here. I try to paint this picture, especially because of a diverse audience. As I said, rabies is an acute progressive viral encephalitis caused by the rabies virus, which is a single-stranded negative sense RNA virus that affects all warm-blooded animals. The virus is maintained basically in two cycles, the urban cycle in dogs and the sylvatic cycle in wildlife. The picture here highlights the sequence of events really leading to rabies, starting with a dog bite event, when the virus gets deposited in the muzzle of the infected animal or humans, after brain through retrograde movement through the peripheral nerves. Upon getting to the brain, it undergoes further multiplication, resulting in encephalitis, and thereafter it moves centrifugally to different parts of the body with high concentration in the salivary gland, where in an event of exposure, transmission will occur. Globally, over 59,000 people are estimated to die every year due to rabies, and a vast majority of the victims are in poorer communities of Asia, Africa, and the Americas, where children less than 15 years of age are most disproportionately affected, largely due to several dog unhealthy keeping practices, such as non-vaccination of dogs, the proliferation really of free-roaming dogs that aids in the transmission of the virus, as well as poor community knowledge among several factors. And most of the victims are in the rural communities. In the year 2015, there was a global call for action towards controlling human rabies death or eliminating human rabies death by 2030 through a One Health approach that takes into account how stakeholders within the animal, human, and environment work together towards achieving the goal of 0 by 30. And at this stage, I would like to highlight some of the critical items that are required, especially around enhancing capacity of surveillance and laboratory diagnostics, so as to assist us in risk assessment and also understanding the burden of this rabies when we have really quality data, ensuring that we enhance create public awareness, especially among the vulnerable groups that I highlighted in my previous slide. Also ensuring that at least 70% of dog population in rabies endemic settings are vaccinated against rabies to break the transmission cycle. Also to control the dog population, especially due to the fact that we have several free-roaming dogs, through humane dog population control, utilization of strategies, which I know someone is talking about oral vaccinations today, as well as ensuring that people are empowered to be very responsible with information, to be responsible in dog ownership practices. Also ensuring that we engage the communities during the course of these processes, so that whatever interventions are deployed will be accepted by the general public. Also having animal reporting, prompt animal reporting through the integrated bite case management that takes into account how stakeholders within the animal and human health sector report cases for risk assessment, as well as proper wound management, utilizing basic first aid measures, such as use of soap and water upon exposure, as well as ensuring that victims of dog bite in endemic settings have access to rabies post-exposure prophylaxis upon exposure. So most recently, the United Against Rabies Forum put forward a document for countries, endemic countries, to carry out a really comprehensive appraisal of various aspects of rabies across their country in order to gain understanding of rabies situation, so as to be very targeted in their approach by developing a costed national strategic plan. At this stage, I would like to really highlight the situation of rabies in Sierra Leone. Rabies was first reported in Sierra Leone in the year 1949, and in Teko lab there in Sierra Leone. And since then, there has been notable outbreak of rabies across the country, including human deaths. A survey estimated 300 annual human rabies deaths across the country, although we know this is highly underestimated due to the fact that we have a passive surveillance system in place in Sierra Leone with a very low dog vaccination coverage of 0.8%. But most recently, we carried out a survey across some districts in Sierra Leone, and we established about 20% of vaccination coverage, taking into account several interventions that have happened in the country and some that are ongoing at the moment. A random survey of 315 households indicated that none had vaccinated their dogs against rabies, or were aware of the importance or aware of dangers of rabies. Also, the abundance of free-roaming dogs across the country. For Sierra Leone to attain the goal of zero human rabies death by 2030, there's a need really to develop a national strategic plan to support prevention and control efforts. It is against this background really that I was engaged most recently to assist or support the stakeholders within the Ministry of Health and Agriculture to develop their national strategic plan. And some of the approaches I deployed really is because the assignment was, I carried out this assignment while here in Australia because of the challenge of COVID-19. So really it started really with engaging stakeholders and partners in Sierra Leone through email exchanges, Zoom meetings, WhatsApp calls, and really so for us to really gain insight into the situation of rabies across the country. Thereafter, we obtained data for human rabies as well as dog bites. And also, we try to look at the cases of rabies that are available from the Ministry of Agriculture. Thereafter, we carried out a comprehensive appraisal of various aspects of rabies consistent with the template provided by the United Against Rabies in order to understand areas of strength, as well as areas of weakness to guide us in developing a realistic strategic plan for rabies prevention and control, and which was followed really by designing their national strategic plan, taking into account the items that we appraised. And one of the things we try to do is really to map the cases of especially dog and cat bites that were available from the Ministry of Health, taking into account the population at risk per district across the districts of Sierra Leone to understand really the incidence of rabies across the data sets we have. The maps here is really showing us the trend, the incidence of rabies across 3 years. As we can see, during 2018, there was increase, especially in the incidence of rabies, dog and cat bites, ranging between 29.15 to 45%. And thereafter, in the year 2019, there was increase in the trend, especially with expansion of the cases to other sister districts such as Bo and Kono. However, in 2020, there's a drop really in the incidence, and it is very hard for us to really rely on data of this sort because we know the surveillance system there is very poor, and this will highlight really why we sometimes have to develop our strategy consistent for some of these gaps that we identified. Also, we try to put together the cumulative number of suspected district level temporal distribution of human death across the districts of Sierra Leone. When we observed there were more human deaths in district of Bo during 2019, and Tonkolili during 2018. And really, it's hard to say what is really happening across the country, especially when we're dealing with a very poor surveillance data. Basically, based on our assessment of various aspects of rabies, really, as I said, using the template provided by United Against Rabies, we try to look at these areas of strength side by side with weakness. And some of the areas of strength really is the existence of current laws on animal welfare and dog population control, the existence of One Health platform with coordinating structure, and I must confess the One Health platform that exists in Sierra Leone is quite robust, which was really one of the support systems that I gained during the course of my engagement with Sierra Leone. Also, there's improved working relationship among One Health stakeholders, including government partners. There were available laws on surveillance for human and dog bites, as well as animal rabies diseases. We also try to look at weaknesses around surveillance, as well as awareness and prevention. And we observe weak surveillance and reporting of rabies. There's low vaccination coverage, as I earlier highlighted. There's no data really on dog population structure to guide cost-effective intervention. There's lack of research on various aspects of rabies, especially research that tends to understand locations where we have more cases so as to deploy these scarce resources. There's inadequate infrastructure or holding facilities to contain dogs for quarantine, there's inadequate funding. We know funding is always a problem. There's also poor public awareness on the risks of rabies, lack of availability of rabies immunoglobulin and human rabies vaccines, and where available, they are beyond the reach of an average Sierra Leone, people in Sierra Leone. Despite the fact that we have existing laws, there's non-implementation or non-enforcement or little awareness by the general public on animal welfare, lack of guaranteed supply of rabies vaccines, lack of storage facilities and cold rooms for storage of the vaccines, among others. Based on our understanding of the situation of rabies across the country, we try to put together objectives that we intend to achieve side by side with the budget, which I will not be talking about today. And the first objective really is to implement mass dog vaccination in selected parts of the country, using the map we have at the moment really to guide us on areas we need to implement a mass dog vaccination campaign. And while this was going, I think there's an ongoing mass vaccination campaign happening in selected districts that is supported by the FLI at the moment. And then also we need to ensure that there's sustained commitment for resources, also to initiate or implement integrated bite case management so as to improve on human post-exposure prophylaxis uptake, increase in case dictation, as well as to improve the administration and curtail waste. Also to facilitate advocacy, communication, and social mobilization through different strategies based on what the prevailing situation across the country. And we also try to see how to manage the challenge of free roaming dogs, which are very prevalent across the country, through deploying strategies that have been used elsewhere, especially I know it's quite expensive, but if we can, what we try to propose is to carry out human dog population control, to also deploy oral vaccinations, as well as engaging people in Sierra Leone by empowering them to understand why they need to be very responsible in their dog care ownership practices, as well as to enhance surveillance for early detection, analysis, and effective response, to investigate various aspects of rabies, including understanding of really locations where we have more reports or hotspot locations, as well as understanding what are the factors that are driving the virus across the country, as well as dog population dynamics. And I am quite aware that through the One Health platform, quite recently, they've put together academics within, and as well as staff members of the Ministry of Health and Agri, to look at priority areas to carry out research, and I'm very pretty sure they are trying to look at how to carry out dog population. Also, the implementation national strategic plan. To scale up the implementation of national strategic plan, including a detailed actionable plan towards the 0 by 30 goal, and to really focus upon monitoring and evaluation throughout the implementation of activities. And based on really the key objectives, we try to look at the key objectives side by side with what we intend to our interventions, and also who is involved, as well as budget for each of these, which time will not permit me to. But for us to implement regular mass vaccination program for dogs in selected districts, we need to seek partners, to seek support from partners, especially international partners such as Rabies. And I'm quite aware that in the recent campaign that just ended across the Leone, Rabies were quite useful, especially in data gathering while administering vaccines to dogs. Also to sustain commitments and resources through really engaging key stakeholders across the country, so as to also to implement integrated bad case management, as I earlier highlighted, through the development of the guidelines for risk assessment, to really recruit people who will carry out this activity, because one of the challenges, although I didn't highlight, is the fact that there is severe shortage of on-the-ground professionals across the country. So through recruitment of people who carry out these activities, also to facilitate advocacy, communication, and social mobilization. There's a detailed item for this component based on areas of need across the country. Also, one of the objectives really is to manage the challenge of free-roaming dogs, as I earlier highlighted, through different strategies across responsible dog ownership, humane dog population control, to deploying oral vaccinations, among others. Also, as well as ensuring we implement existing laws that will ensure that people are very responsible with their dog ownership. And also to enhance surveillance for early detection, analysis, and effective response. Also, really through how we recruit people who will carry out these activities. The fact that across the whole, the vets across the country, so we need to really ensure that we carry out recruitment for especially the veterinary sector, training of surveillance officer on how to collect samples, and use of decentralized point of care testing, as well as collaboration between institutions across the country, especially universities, so as to aid in surveillance. Also to research into various aspects of rabies. As I earlier said, I think this aspect is currently being looked at through the One Health platform with support from from FAO. Also to ensure that we put together monitoring and evaluation to really monitoring and evaluation of our activities during the course of our implementation. So basically, this is just a brief summary. The document is quite extensive, including a budget for each item. At this stage, I want to really thank stakeholders and partners that gave their inputs. This project was supported by World Bank through the World Organization for Animal Health, the OIE, as well as my mentors who gave their input during the course of developing this strategy. And thank you very much for listening. I'm happy to take your questions.
Thank you, Philip. We appreciate your very thorough summary of some of the challenges. And I'm wondering, based on your experience, is it realistic for Sierra Leone to meet the global challenge by 2030?
Sorry, Prof, can you come again?
Sure. Thanks again for that thorough presentation. Based on your experience, do you believe that Sierra Leone will be able to meet the goal by 2030 for elimination of human cases caused by dogs?
Yes, with adequate support, I believe they will be able to eliminate human rabies death mediated by dogs. But at the moment, there's a bit of challenge around implementing this. We have put together the document, it's quite robust, but the challenge remains around resources. So if they are able to get the required resources, I think it's achievable.
Excellent. Thank you very much. And I know it's very late there in Australia. I hope that if possible, you'll be there for our later discussion.